In this week's What's Going Around, we're talking about croup. Now, croup is caused by a virus, and it typically causes a characteristic barky cough. Now, I'm sure at one time or another, you or your family members had that barky cough and you wondered if it is croup or not. Well, typically croup will affect very young children. It doesn't happen that often in older children or adults because their airways are different. And then the young child is more predisposed to swelling and inflammation that happens below the vocal cords down in the trachea. And with that barky or seal-like cough, because it's below the vocal cords, they'll have hoarseness with their voice, also hoarseness when they cry if they're an infant. And then lastly, the other sign would be stridorous breathing. So as that obstruction, narrowing in the trachea and they're getting air through there, they're going to get this high-pitched type of wheeze that occurs in the airway. It's very characteristic of croup. Now, because we have that obstruction, croup can be dangerous because we're blocking the airway. You can have mild forms and the child just has a cough and that hoarse voice. More severe form where the child's struggling to breathe is a medical emergency. You need to get in and get that checked out in the emergency room because they may need immediate respiratory treatments, breathing medications in to help relax the airways. Also, steroids or corticosteroids administered to help reduce the swelling in the airway. Now, one of the home remedies or treatments we even use in the hospital is a cool mist or cool vapor that they help breathe in to relax the airways. It's not uncommon for a parent to wake up in the middle of the night, hear their child coughing and wheezing, and run out the door, hit that cool mist outside, and they actually start breathing better by the time they get to the emergency room. But don't be fooled because this can come back. They need more definitive therapy to prevent it from flaring back up.